Okay, turning now to an alarming health trend. This is important. A new report released by the American Cancer Society Tuesday is revealing that breast cancer diagnoses are on the rise, especially among younger women.
The report found that breast cancer rates have increased by 1% every year since 2012. And among younger women, the rates have gone up by about 1.4% every year since 2021.
Joining us now is NBC News medical contributor Dr. Kavita Patel, friend of the show. Of course, Dr. Patel, good morning. So the report, it also showed differences among specific groups. We want to pull this up here. Among Asian American and Pacific Islander women under 50, breast cancer rates have increased by 50% since 2000. What a number. Walk us through the study's findings. Why are we seeing this happen with these groups and with younger women?
Yeah, Savannah, Joe, it is very troubling, but it's something that we've been seeing for years now, and now we have some numbers to back it up. So 20 years of data looking at breast cancer, over 200,000 of women that they looked for to see kind of patterns. And as you said, not just an annual increase, but a really troubling increase in the ages of 20 to 29. I want to call that out for a second. 2.51% annual increase in breast cancer rates for the ages of 20 to 29. And then, as you mentioned, at least a percentage a year. And then if you are Asian American, Black, Hispanic, even American Indians, every single kind of racial category had some shift. Asian Americans, higher rates. Black women, even though they have a overall 5% lower breast cancer incidence, they had a 38% higher mortality. So less breast cancer, but when you have it, it's actually killing you earlier. Hispanic women also seeing at least a 2% increase. So this is very troubling news, but it's kind of consistent with what we've seen in the data over the years.
Dr. Patel, I want to ask you about one thing you mentioned, which is that racial disparity of Black women far more likely to die of any type of breast cancer than their white counterparts. Remind us why that is, because it's something we've been talking about for years here, and what we can do to try and close the gap.
Yeah, so we've been talking about this, and in fact, there's actually a separate study to try to understand what the appropriate screening interval is. Just as a reminder, we'll talk about it in a minute, but there are general screening guidelines for overall population of breast cancer. But we know that for Black women, that there are significant risk factors, not just genetic risk factors, but there are also environmental. There's a number of risk factors with Black women, especially coexisting conditions. And on top of that, this is exactly what we need to understand. When do we need to screen? And why is it that they're facing like lower survival rates, higher mortality rates? And also, I think in general, Joe, I think there's just less awareness about this potential. So when women talk about their own breast cancer risks, they are often kind of neglected. And especially if you're a Black woman, often denied that access.
Other issue, right, which we could do a very long segment on, is even when we talk about getting screened, it's like, are people getting screened young enough? Then you find out you have dense breasts and you need an ultrasound, but that's often not covered by insurance. What's that's going to cost you? Any other type of screening. But just for somebody who's hearing this and is worried, maybe they fall into any one of these categories we've been talking about, what is your advice for screening and how to talk to your doctor about this?
Look, I think, first of all, dealing with risk factors. We think that alcohol consumption, decreased physical activity, having children later in life, I'm in that category, reduced breastfeeding rates. Environmental researchers are looking into whether any of these could be factors and all of the above. I think every single woman, no matter what age, should talk about breast cancer risk and when they should get screened. 40 is the starting age for all women, but everybody under the age of 40 should ask about kind of their risk when they see their gynecologist.
Dr. Kavita Patel, so important. Thank you very much.
Thanks for watching. Stay updated about breaking news and top stories on the NBC News app or follow us on social media.